So thanks for joining us on today's episode of Techbridge on Lagos Television. This is the show that we say and we claim that connects you to the future. That is actually right. And when we talk about the future is not somewhere far. It is just right here with us because technology is that future we are talking about. And it's always getting better day by day. I'm Sheyefumi Olatide and I welcome you to today's episode. So we realize that technology is not leaving any part of our lives behind. It's cutting across everything you can think of. And today we are focusing on our health, the health sector. So we are talking about how technology affects the health sector in terms of accessibility and of course ease and lots more. So I'm going for this quick break for you to get the full gist of what this is all about. Please stay with me. It's still Techbridge on Lagos Television. So thanks for staying with us. It is still Techbridge on Lagos Television. And before that break, I told you that we'll be talking about digital health today. And from that word is just two words, and it's talking about the combination, or should I call it the marriage, between technology world and the health sector. So we are beginning to see this reality, the changing narrative that you don't have to be necessarily present at any facility, any health facility to receive any treatment. And of course, the accessibility is faster. And at the long run, if you look at the entire picture, it is cheaper now. So I'm not going to do much of those talks. I'm going to leave you with the experts to talk about that. There was an event recently held in Lagos talking about health and technology, the exact role technology is playing in these present realities. So there are about 3 doctors that talked about this. Dr. Bola Olashibikon is one of them. And of course, 2 other ones, they are experts in their own field. And they gave in-depth analysis, revelations about these new offerings of digital health. You can call it e-health. And I'm just going to leave you with the details. Stay with me, still Techbridge on Lagos Television.
And as its basis form, digital health is a combination of digital technology and healthcare. With digital technology referring to electronic tools, systems, devices, and resources that generate, store, and process data. While healthcare refers to organized provision of medical care for individuals and communities. So simply, digital health is the use of electronic tools, systems, devices, and resources to generate, store, and process data for the organized provision of medical care for individuals and communities. And interestingly enough, in the past, when we heard about the term digital health, or e-health as it was known, our minds first of all went to electronic medical records. But fortunately, in this day, it goes far beyond that. But no matter the amount or no matter what you think about as regards digital health, it falls into one of these 5 categories. The first being telemedicine, which is providing care remotely. Many of us are aware about this. The second is payer administration and hospital administration. These are the well-known hospital management systems. We have the health consumer engagement. These are ways of providing information to users that pertain to certain points in the time they need it. For instance, I was privileged to participate in a training of a company who provides information for nursing mothers and early mothers at the time they need it. So for instance, when you register, at 1 week you get the information you need for that week. At 2 months you get the information you need for that week. So that falls within this category. We also know about digital therapies of the electronic pacemakers and also devices that are able to provide you the medication you need at the dose you need at the time you need. Finally, we know about personal health tools and tracking devices. At a point, it became a fad for people to wear wearables. Fitbit at one point in time was very popular. This helps you monitor your health regularly. So basically, anything you can think of within the digital health sector falls into one of these categories. With regards to the benefits, there are both benefits to the organizations and benefits to the individuals. I'll begin with the organization. The first is electronic medical records. Many of us are aware that while we were in medical school, for instance, or were practicing, there were specific rooms called records, whereby there are files that go a long way. But in this day and age, we are able to digitize all these files and make it more easily accessible and more easily usable. We also have the sharing of information. With regards to the medical or hospital management systems, these days you get to a clinic, you put in your records, before you get to the consulting room, they're already there. The doctor sees the patient, puts in his request, before you get out, it's already at the pharmacies or the lab. So this has helped the system become more efficient. We talk about inter and intra-organizational collaboration. So we know right now that a few people can work on a certain case from a certain record. It's similar to what we do now with the Google Drive and Google Documents, where multiple people can actually comment on a certain information. And so a doctor in Nigeria and one in US can actually put minds together and solve a case. We have digital therapy, like I've talked about before, and privacy and security, in the sense that there are now cyber security tools that enable people ensure that data is more secure. In the past, all you had was the key to the records room, but right now there are better ways of securing our information. So for the users, we have diagnosis and treatment, especially with the advent of AI that enables people that may not be medical professionals able to come up with diagnosis with this assistance. For instance, a year back, I was in Nairobi for a program, and we went to a facility called Kurafa, where they have what they call clinical technicians who are supported by either doctors away from where they are or by AI devices to help them come up with more credible diagnosis. So this helps the patients get exactly what they need. We talk about managing chronic conditions, and that's where the wearables also come in. To constantly monitor your health, and also when there's a red flag, inform those interested in the case to know there's something going on and there's something to do. There's also a device I came across recently which also helps detect the fall of elders. So when somebody falls, people are alerted that that person is on the ground. We have access to rural and remote communities. This is also very interesting as regards telemedicine. We have accuracy and convenience. Again, I remember while I was still practicing, where you see a patient, but many times you're uncomfortable stopping and checking through the books, because no matter how brilliant we feel doctors are, they still forget some things. But to ensure the patient still have confidence, there's a limit to how much they can check through. But currently, there are many devices and many platforms that input these resources in their platforms such that when you're seeing a patient, you can actually cross-check things in real time.
Technology has a tremendous impact on care. You can't diagnose, you can't treat if you don't know what's wrong. Gone are the days where the person will look at you, place a hand on your chest, place a hand on your stomach, especially in eye care. If you come to an eye hospital with vision problem, a stethoscope won't help my physicians. It doesn't tell me what is in your eye. Eye care is very highly technology dependent. I have to see in the eye. You might have bleeding in the back of the eye that even you don't know. So technology for us is really important. Not just the hardware, it's the software. We talked about electronic medical record. It's also the drugs. We should be able to verify the authenticity of the drugs we're giving our patients. Outside of Nigeria, the barcode scan, they scan the barcode on the drug and they can tell where the original ingredient for that medication came from, right down to where the patient is receiving it. It's possible. And so these are the things that we definitely need to leverage on. But when it comes to technology, I think we all can speak from experience. If you're not manufacturing, you are importing. So where we all understand and we can all concur and agree of the importance of technology in healthcare, we can also reflect on the fact that very little of it is being manufactured here in Nigeria. So when we speak of technology, I mentioned diagnostics, treatments, medication, research. There's no advancement without research. Research has gone beyond the pen and paper collecting documents. There's no advancement without research. And we're a mighty nation with population. What is healthcare research? It's population. Looking at the population, how do things affect them? You know, what are the dynamics of a disease? Those are the things that use, and yes, many people are doing research, but we all know that we're different. And if we don't take the time to look at how diseases and medication affect us, there will be a lack of information. So it's very, very important to understand the gamut of impact of technology. It's very important for us to develop national solutions, but with a global mindset. When you're building something, reach for world standard and bring world standard to Nigeria, whether it's through an app, through a solution, to telemedicine, through AI. We should build nationally with an international and a worldwide, a global mindset. Information is power when it's harnessed. You know, some people sell information. When you have data about Africans, how Africans respond to diseases, you can sell it to companies who have the capacity to build, or you can use it to build yourself. So technology definitely has a humongous impact on healthcare, and it's very important for us to take the bull by the reins and be the seat for that technology development. Technology is not inexpensive, kind of as I mentioned earlier. So financially, it's kind of it's a plea to the financial sector. I understand that once resources are given, a loan is given, you're expected to have returns. But returns in healthcare is not the same as returns in energy. Financing is not sector agnostic. So when all of us here, we're stakeholders, we have big dreams, we want to support innovation, we want to fund innovation, the funding is not practical for the sector. So it's very important that the funding that we get to support innovation is not sector agnostic. It should be sensitive to healthcare, the margins in healthcare, and the healthcare business. And if it's expensive for those delivering healthcare, guess what? They pass the cost down to the patients. And what does that do? It makes access even more difficult. And we're back to the point I made earlier. We have many, many people who are in need of care. The biggest challenge is access. Key barrier to challenge is cost. So funding and financial support is definitely a huge aspect of how we can make the necessary progress in healthcare. We need primary care, we need secondary care, we need tertiary care. One hospital can't have primary, secondary, and tertiary. If you're doing it, you're stretching yourself. Partner. Get your primary care networks, let them refer to your secondary care networks, distribute the burden, and it's going to affect all of us, and it's for the betterment and for the livelihood of all of us who live in Nigeria or have loved ones who live in Nigeria.
Innovation is the thing we've been doing, and we feel it should become more popular. The traditional way of doing things may not take us far again. So we should begin to do innovation. We should begin to innovate. We should be thinking out of box to be able to get solutions to most problems in our health system. Technology is the way forward now. I think we don't need big hospitals again. When they say they are constructing a new something in Abuja for something, I say, why don't you take a ward in some of the abandoned hospitals? When I was Commissioner of Health in Kwara State, we have many hospitals and many health centers in 16 local governments, and we decided to pick one and make sure they are functional. We don't need to build hospitals again. What we need to do is just to equip and transform the ones we have. And there are so many hospitals that are even abandoned. So I think with technology, you don't need hospital again. You can treat somebody in Sokoto or Port Harcourt from here without going to anywhere. I think we will have the benefit of that.
So it's still Techbridge on Lagos Television, and we're still talking about digital health. You call it e-health as well. So part of the things that we should begin to note at this point in time is that technology is affecting health sector tremendously. And when we talk about that, you can't rule out the fact that research plays a major role in all these discoveries. And as a way of recap, one of the things I want us to, realize at this point is that digital health is actually going to give us more access to good and proper health care. we realize that you don't have to travel far, and of course, you don't have to be physically present with a doctor or your physician. There are a lot of apps that can also help you. Remember that there was an episode, I think the episode was called Health and Wellness Apps or something. You can check our YouTube channel to watch that episode again. It's talking about various apps that you can use to improve your health, not necessarily seeing a doctor, but it can serve as a guide for you, and you don't have to panic at every instance of health issues. Then another thing we realize is that it's going to give us better employment opportunity, especially for these medical practitioners. I noticed that somewhere on Facebook there was a particular page for doctors, I think it's for gynecologists really. They mentor people, they give their pieces of advice, and of course, I call it consultation. People actually subscribe to that page. So that way, patients don't have to be physically present at these doctors' hospitals. It's still leveraging on technology to improve our health. So part of the things we need to realize is the fact that technology is also enabling more people to participate in quality health care. One of the doctors that spoke during that event mentioned the role of health insurance. And really, if you ask me, that is the way to go. Like she said, and like we know, we can verify, it is not a new concept. It is just that it is, let me say, not so embraced in this part of the world. But if you ask me, it's going to make access to quality health care cheaper and probably easier. So if you put all of this together, you realize that you don't have to be allergic to this new development. Just like every other technological advancement that we see, people are always, most of the time, not so receptive about it. But over time, we begin to fall in place. And if you ask me, that is the way to go. Leveraging on technology, leveraging on artificial intelligence, softwares, mobile apps, and of course, various platforms to manage our health. You know that at this point, you don't have to get to the hospital to measure your blood pressure. There are smartwatches that can actually give you the exact figure, your blood pressure, your heartbeat rate, the amount of calories you are burning just with a smartwatch. That is possible. It's still talking about digital health. If you want to take advantage of technology, begin to think how to take advantage of it in the health sector. So that's our show today. Many thanks for joining us on today's episode. Remember that Techbridge is available on Facebook. We are Techbridge LTV. And of course on YouTube, it is Techbridge LTV as well. Remember to subscribe to our YouTube channel so that you can have a prompt update of every fresh episode. And of course, watch previous episodes again and again. So till some other time, I'll tell you that keep leveraging on technology and keep achieving more. I'm Sheyi from Yola today. See you in the next episode. Bye for now.